Welcome back, everyone. We're just about ready to close out. We've got one more important thing to do this afternoon, and that's to tie it all back together. You had your breakout sessions. We looked at the healthy, the safe. We looked at the educated. We looked at the growing and the mobile. And now we're going to bring it all together. So thanks for your effort so far. We're going to need a little bit more participation, a little bit more discussion now to find out how these things span across all of the agencies. So there might have been some conversations in your room that should come out now when you notice things that were spanning agencies. And to lead us through this, we have Tom Mokel, who's the president of 10-Step Facilitation. They've done a nice job here today. They came in and they took a broad range of topics, brought them together, got dots on the board. And so I'm going to turn it over to Tom to facilitate, and I know that you guys have volunteered, that somebody in each group has volunteered to come up and talk about your area. And so, Tom, thanks a lot. Here you go.
Thanks, Joe. Can you all hear me all right? All right, so after saying volunteered, I must admit that in our group, we had a hard time getting a volunteer, so I wrote a number between 1 and 14 on the flip chart and turned it around, and then everybody had to guess a number. And Deidre was the lucky person who got the number 3. Who'd have thought it would be so unlucky for you today? Okay, so what we're going to do is we're going to have each group report out. You got 7 to 10 minutes so that we can get through all 4 of them in about a half hour, and then we'll have an open discussion on other observations. We'll look for spanning strategies that were in common across all the groups, and talk about how the sessions went. Okay, so Deidre. And you might think I'm picking on her by having her go first because she was in my group, but I originally had her sheet in the middle so she didn't have to go first, but then she said, I'll go first. Thank you, Deidre.
Hi, I'm Deidre Jackson with Georgia Vocational Rehabilitation Agency. And I was with the policy team that focused on growing and mobile. And basically we went through the spanning strategy activities, and the strategies that we selected were web services, data management, document management, and then the new one that we added was big data. I'm just going to go through each one of those. For web services, we voted. All the agencies got a chance to vote on those that were important to them, and we identified for web services that there was a high benefit as well as a high cost, and we thought that the enabling technology that supported it was improving customer access to online services. The second strategy was data management, and we also felt that there was a high benefit and high cost associated with it, and the enabling technology supporting it was expanding the use of data for decision making and information sharing. The third strategy was document management, and we felt that that one had also a high benefit with medium costs, and the enabling technology was redesigning business processes and automating and re-engineering those processes. And then with the last one with big data, we actually had a discussion around it because we found that many of us didn't really understand what it was. And so we were reminded of the earlier session today of how we're collecting more and more data in many different areas, and being able to utilize the data is really what big data means to us. And we thought that that was the big need there. And we had a little bit of discussion and couldn't really reach consensus as to whether or not the costs were high. But we did feel that the benefits were high and the costs were high. And then there were some who also felt that there was medium benefits as well as medium costs. But we were able to tie each of these strategies back to the governor's strategic goals. Are there any questions?
We'll take the questions later.
Okay.
Thanks, Steve. Excellent. Excellent. Thanks for going first. Okay, and going left to right, Bob, would you be able to cover the educated session? Sure. Thank you.
My name is Bob Swigum. I'm from the Department of Education in Georgia. I'm the CIO. What we did is we actually tossed out the original document we were given, because that's what we typically do in IT. We throw out what we were given. What we did is I was the only DOE, or I was the only education person at the meeting. So it was really easy, the voting part. But what we did to try to represent all of education is we went back to a document that's developed by our alliance heads. The governor actually has a mandate for all the education agency heads to get together on a weekly, God, that would be horrible, on a monthly basis and talk about how their strategies align. And they have an overriding document with 5 strategic goals. And so we started with that. And that made a whole lot more sense because it connected all the different agencies. So these are the 5 agency goals, and you can find them on the website. The DOE website has a connection to them. And we went through and we tried to align each one of the agencies with the 5 strategies. And we went through and we found where the governor's goals were all lined up. And we did the cost-benefit analysis as best we could. And this is all relative. Obviously, when you're talking about this, am I supposed to read each one of these and go through them? And no, okay. So like this particular one is about the kids in Georgia. So you're talking about 1.7 million kids. So that is going to be a high benefit but a high cost. Whereas you get down to this one, strengthening teacher quality, now you're talking about 120,000 teachers versus all those kids. So the cost is less. It's still really expensive, but so it's a relative measurement. And then we took the GTAE 6 initiatives and tried to button them out here to do the alignment. So that worked out fairly well for us because even though we didn't have all the education agencies there, we did have the alliance agreements for all of our bosses have gotten together and already agreed to this. So next steps for us were basically we have every other month we have a meeting of all the CIOs from the different educational agencies where we talk about aligning our strategies and working our initiatives together. So we're going to invite this team to bring this document in and actually go through this with the rest of the agency CIOs to make sure we're all in alignment. So that's the next step to firm up this document.
Thank you, Bob. All right, and for healthy, against my better judgment, oh, you want to go one? Okay, they're going to have 2 people come up. Kind of a comedy act, I think. Mark, or Brad, sorry.
Yeah, hi, I'm Brad Pesto, and I'm with the Division of Family and Children's Services, part of DHS. And as you can see, it looks like we were the overachievers here. Yeah, there you go. All right. Our healthy strategy, we looked at our different spanning strategies here, and we came up with a few extra ones. The agencies represented in the healthy breakout session were the Department of Community Health, say hey out there, there you go. Department of Community Health, Department of Public Health, there you go. Department of Behavioral Health and Developmental Disabilities, where are you out there? There you are, there you go. That's, yeah, okay, that's our hairy dog. And DHS, all right, DHS, there we go. Our first spanning strategy was business intelligence, and we linked that to all 4 of the state goals. And the state goals were to reduce child obesity in Georgia, to increase access to health services throughout the state, to increase consumer choice and personal responsibility in health care, and improved access to treatment and community options for those with disabilities. So we were able to link that to all our state goals, and we felt it had a high benefit but a medium cost. Care management, that's the reduction of Medicaid expenses and Medicaid costs. Link that to our 4 goals. It was actually represented by all our groups except for DBHDD with a high to medium benefit but a low cost. The health information exchange, a high cost and a high benefit, and all our agencies were represented on that one. Data warehousing, high benefit and high cost. Grant management, we felt had a high benefit but a low cost. We felt there was a good benefit to cost ratio there. Access to information and training, again, a high benefit but a medium cost. Web services, that's not your traditional web services, what you think of middleware web services. That's actually presenting information on the web or self-service or getting getting access to our services through the web. Again, high benefit, medium cost. Document imaging, document management, the sharing of documentation across the board, high cost as well as a high benefit. Time tracking, a couple that we've added here: time tracking to support some of our expenditures, a medium benefit, a low to medium cost, bring your own device strategy. We felt we needed a bring your own device strategy to support our operations. Again, a medium to high cost and a medium to high benefit. We felt that there was so many unknowns around there that it was hard to estimate the cost and benefit on that one. We did see that there were some of these that tied together very well. The business intelligence, the health information exchange, data warehousing, document imaging and document management, as well as some of the web services to a degree. We felt those tied together. We felt that one of those strategies it was very difficult to implement without another strategy, and so there were some very close ties and very close interfaces between those.
I'm glad I didn't facilitate that group. And Mark on the last one.
I'm Mark Waldron. I'm the Director of Planning and Strategic Management for the Department of Corrections, and I represent the Rainbow Coalition here. Safe Georgia. Understanding that we addressed the priorities and the strategies from the common denominator between GBI, Department of Corrections, pardons and paroles, DJJ, and that is the offender database. The five that we chose were centralized data management, and we're talking about criminal justice and offender information. That's key. If you go back, and we gleaned a lot from Dr. Carver's speech this morning in his presentation. One is resources are scarce for all of us. There is great benefit in pooling our resources for the better of the group. And as he said, you know, the more he can bring in to the negotiation, the lower price and the lower fees and the lower number of resources we'll have to put up from the state. We kind of looked at it from the standpoint of we deal with the same population. I mean, GBI goes out and does investigations on offenders that we wind up at some point probably either taking in as offenders and inmates in our prisons or supervising on the streets on probation. Parole does the same thing. They take them out of our prisons. So when we talk about that information, and there is such a need for big data. Everybody wants to know everything. And it goes back to what Dr. Carver talked about finding out how much data you need to make a decision. And I went through with him this morning and said, you know, it's like showing somebody a baseball. How many angles of a baseball do you need to see before you realize it's a baseball? And every other angle that I show you of that, it's still a baseball. That is the challenge for planners and for us in the data side of the house, because people think I need to know more information. Well, give me some more information. Well, I can tell you the shoe sizes, the heights, the weights, the physical health, all those characteristics of every offender we have, but it doesn't help legislators make a better decision on how many beds do we have for males and females, because that's all we have. Now, we have some that kind of fall in between, but all we deal with are males and females. How many bed spaces do we need for males? How many bed spaces do we need for females? So when we looked at this, we said, you know, if you took and created a state-level criminal justice and offender information center and pooled all of our information going into one data center, then you could hire statisticians and doctors that can analyze the data and get 3 or 4 of them instead of us all trying to go out there and find 1 or 2 on our own. The other is you can then set the center up to where the resources are. Our headquarters, for those of you that don't know, is down at the old TIF campus in Forsyth, Georgia. Needless to say, it's hard that's not a big draw for people to come down to Forsyth, Georgia and work, to move and work and live. So these are some of those things that Dr. Carver pointed out. Those are some of the innovative ways we need to look at it. Centralized data management, access to resources in the field. Again, our resource, our primary resource are the officers that we have in the prisons, are those officers we have on the streets doing community supervision. The more data we can give them in the field so they can do their job in the field, the better job they'll do, the safer Georgians will be. Access to information and training. Again, Dr. Carver pointed out the traditional way of getting an education is quickly moving on to the non-traditional. A lot of people, how many in here have received an advanced degree? through the web or through other non-traditional. Didn't go to school for 4 years or the 2 years it took to get a master's degree. That's the wave of the future. We need to make those resources available not only to our employees for succession planning and their benefit, but think about what one of our jobs is, and that's rehabilitation and education of offenders. If we can educate them, if we can get them the education they need through some of the technologies and systems that are out there, then the better chance we give them when they get out to keep from recidivating. Web services, obviously, we want to improve those, and document management. That's a big one. I mean, these court cases, we can't throw that away. We can't keep collecting paper for the rest of our lives. By pooling the assets of the law enforcement agencies and going to a more streamlined model in this, it's going to be a high benefit, but it's going to be a high cost. But it also allows for emerging technologies, and that's one of the discussions we had in there. It seems like by the time we find a piece of technology that we like in the Department of Corrections, and finally are able to get through the contracting, negotiations, and everything, get that piece of equipment, it's already antique. They've moved on to the next one. So again, if we can leverage the limited resource we have under a centralized information system and a warehousing system, I think we'll be much better off. The last thing I want to point out is one that's near and dear to our heart, because data is our lifeblood as far as understanding our offender population, and that is disaster recovery and business continuity for us. If the system goes down and it affects GBI and Department of Corrections and pardons and paroles, then we are in a world of hurt. At least if we've pooled systems, we've got a better mechanism for recovering that data and for keeping business continuity going. Now, that's going to require us to change across the board in the law enforcement agencies to do some business process changes. We can do that. It's going to require us to leverage some new technologies and increased connectivity in a lot of cases. The business continuity piece I just spoke to, the customer base. And again, we looked at our customer base of not just being what's in the metro area or where our facilities are for the majority, but we're looking at continuity for the whole of the state. And it's very easy to lose sight of the fact that there is a lot of Georgia out there beyond the scope of metro Atlanta. So that's the way we approached it. So that's it in a nutshell, sir.
Thank you very much. Okay, so you've had a chance to look at the other sessions, not just the one that you were in. And we're having time now just for an open discussion, for observations. I'd be interested if you have any feedback after seeing the rest of the breakout sessions and what they did. Anybody want to volunteer an observation?
I think you're going to see a lot of, although we focused on the safe Georgia piece, a lot of our discussions went over to the education piece and the health piece. For example, we talked about centralized data management. We kind of encapsulated that. One of the strategies that we had on our sheet was electronic medical records. And that was for our offenders. But that bleeds over into the healthcare side, because if we go to an electronic medical records system, it's going to transition from the safe Georgia piece when those offenders go back out on the streets to the community health side. So there's a lot of this that we're going to get some cross leverage on the strategy.
Right, including like data warehousing. I think a lot of us talk about data warehousing as well, like coordination for you guys. So it looks like there is that common thread through most of each group. We have that common thread.
Okay, thank you. Other observations? Over here? Actually, hold up a minute. I'm going to give you a mic. They're recording the session, so I want to make sure it's loud enough.
Tom, I was just going to ask if you could maybe observe what are the key strategies that span the different policy areas and get some input from your folks there.
Okay. As you were talking through the different strategies, which are the ones that you feel like have more commonality between the different groups? You might have seen I was taking some notes, but what were your observations? Okay, data management. I've got, and let me just stop on that one for a minute, but I've got data management, business intelligence, data warehouse, centralized data management. So in a big data, so in a couple different places, it seemed like that one popped up a lot. What was another one?
I think we need at least consider training, because as we talk in ours, as knowledge-based retires and those kind of things, we really need to start thinking about what kind of training do we want to do. I don't usually need a microphone. This is very dangerous for me. I think as we think about the training piece of it, sometimes training gets put on the back burner for a lot of things. And I think if we bring training to the forefront when we do all of this, then we'll have more of a knowledge transfer instead of a big knowledge loss as people retire. Not that I'm close to retirement age, but some are.
Okay, thank you. Let me pass this down.
I kind of brought it up in our discussion. Data management is a big animal, and I am really interested in understanding how do we start data integration between the different agencies when we start using Georgia as an enterprise rather than all these independent things. Beyond the fact that we have the same pieces of data sitting in 100 places across the state that may or may not match, how do we leverage and build something that we have one source of the data and bring it all together so everybody can use it and everybody's not building their own thing? I mean, to me, that's what data management was really about.
Thank you. Yeah, we had a good discussion in our group that everybody could have their own warehousing strategy and everybody can be doing big data. But is that really what you want? 35 or 36 big data repositories. Other comments? Over here.
This sort of ties in with the data warehousing and management from the statewide enterprise perspective. I think it's important to look at the websites. Every single program has websites. We all need to link with our partners in other agencies, and particularly in these different policy areas and groups. And I see a big need for us to maybe have some better common website standards or how to build the platforms, and then who's going to keep the information up to date. It seems like every time I even go out as a consumer, and if we're trying to do this as part of the need for online services and improving online services for our customers, we need to make sure that we're keeping all these websites up to date and all the links up to date and accurate. It's so frustrating when you're on a website and click, and it says it's going to link to something, then it doesn't. And so that's my desire for one of these strategies. Thank you.
Data services was one of those that were common, that was up on 3 of the sessions, data services. Again, since I was a facilitator in one of the sessions, I have the firsthand knowledge that we were talking about data services, traditional web services, but also we were rolling in there apps, like iPhone apps and Android apps. So covers all that. Okay, other observations, data or web services? Okay, and the other one I saw up there that was in common for multiple groups was document management, imaging document management, and then the last group also had document management. So it looked like those 3 for sure were common across multiple groups. Any interesting discussions in terms of document management from your groups that you wanted to share? Okay. All right, so would anyone like to share how your session went? Because partly it's the understanding the results, but also everybody had a chance to participate in one session. So I know what my session was like, but I'm not quite sure what yours were like, especially the ones that have all the different spanning strategies. Anybody want to comment on how the dynamics of your group went? Okay, just now say it into the microphone so we can.
Okay. Yes, we linked and bonded very well. We found out that somebody thinks red is orange. But I think together we all came together and had a lot of the similar ideas. And I mean, across the agencies, it's amazing how much we all have in common of what we feel we all need. Just like you just said, that we need, to make sure that the websites are updated. And then, right away, we had a little bit of discussion on that, but do you need someone to manage your websites? Absolutely. They also need to make sure that Facebook and Twitter and now Instagram, make sure all those things are updated, because as technology moves, we can't just stay still on a stagnant web page. We have to keep moving forward as well. And you start thinking about younger people, and they do Twitter especially, and that's how you get them to come to some of the youth and some of the health fairs and things like that. So it's a commonality between all of us. I was in the healthy. Yes, I was. How did you get through 10 spanning strategies? Oh, we had 30 minutes. We went and ate a brownie. Hustle a coffee, hustle a brownie. We had plenty of time. Once we told him what red was, we were good. By the way, our facilitator, I want you to know he wasn't even in there. So we were free to do what we wanted to do. That's why we got through fast.
Would you like to MC the rest of this? She's shy, she said. Very shy. Okay, anybody else? Observations on how your group dynamics were? Okay.
Now, I sat in on the SAFE group, and the discussions were all very good. I was just going to bring up that one of the places where we hit a hitch was a discussion about what was meant by enabling technologies, and some of the words that were chosen as enabling technologies weren't quite technologies. So, we kind of got in a little bit of, not just semantics, maybe it's partly semantics, but also just trying to make sure we all understood what it was what question we were trying to answer in the last of the columns. And so that did that did present a bit of a hiccup, but as you can see, we were able to come up with a few answers at the end of it. But basically, we decided that we just asked ourselves, for each of those things, which ones would be needed in order to successfully achieve our strategy. But I just wanted to say that was one thing that we did have to discuss through a bit.
Thank you. And I'm glad that the groups felt empowered to make whatever modifications they wanted and make whatever assumptions they wanted. Other observations? Okay, well, let me ask you if you, depending on how well you can recognize the color patterns, any thoughts to discuss what the different enabling technologies are and how they got spread across the different groups? Do you see any obvious areas that look like they have more interest than others?
From the healthy perspective, one of the things I did notice was that we had the changing your business processes was one of the strategies that applied across the board to all our different areas, and I thought that was very interesting.
Okay, any other thoughts on the colors? All right. Well, in ours was the one over here that has all the dots in a neat rows or neat columns.
Well, that spoke to your group.
Maybe it spoke to the facilitator.
Oh, that would have...
Maybe. All right. So we could observe out of the 6 or 7 enabling technologies, there were 3 of them that looked like they were fairly dominant. The green, the yellow, the orange. And I'm not sure if that holds true with the rest of them. Green is improve workforce mobility. Yellow is expand data for decision making. And orange, improve customer service to online services. So that might or might not hold true with the rest of them or not. Okay, so any other observations? I don't want to keep going here, emceeing too long if we're done. Any other observations? Okay, thank you. So let me turn it back over to Joe.